的活动啊，这是我们第一次的有历史的纪念意义的这次讲座。那我也很高兴于前教授能够有机会一起主持。那我们现在来介绍我们第一位讲员。我们这位讲员呢是从加拿大来的，是杨医生。那杨胜天这个医生呢，他是B省大学的家庭学临床教学医生。另外呢，他在树林医院的 Gateway 技能医疗中心执业，同时呢，他也是这北三角洲家庭医生分会的董事会的董事。那他还有很多很多的奖，这个介绍我就不一一介绍，节省时间，请杨教授来给我们做讲座。
谢谢你们的介绍。我对你们所有人今天帮助组织这次体验感到非常感动，谢谢，谢谢。我是加拿大的家庭医生，在温哥华出生长大的。这是我第3次来到中国，我去过香港，我去过海南岛，这次我来到青岛，这是我第1次来到青岛，也是我第1次在中国参加医学会议。我觉得青岛很漂亮，我很开心可以在这里跟你们学东西，还有吃很好吃的东西。在网上的朋友们，我希望你们后来也可以吃我很喜欢吃的东西，在青岛。我想感谢毕宏老师，还有想感谢杨说，感谢 Dr. Frank Zhang 医生，还有感谢我的父亲，我的爸爸杨光医生，还有我妈妈唐瑞凤，这次帮我很多来到青岛。我也想要感谢我的老婆 Sharmila， 帮忙我看病人，她也是医生，在12月。谢谢大家的欢迎来到这个大团体。在我的生活中，我只在中国待了差不多2个星期，所以我的中文是从功夫片、电影学来的，或者还有卡拉 OK， 还有在加拿大的中文学校也有学。所以当你们跟我说话，我只懂差不多60%，看中文只懂5%。我喜欢用翻译的 APP。这次的讲座，我温哥华的朋友，他名字叫 Ariel Xu， 还有 ChatGPT， 帮了我很多来翻译英文到中文。Ariel 和 ChatGPT 花了很大的精力来准备这次的讲座。我做家庭医生，我很感兴趣治疗青少年的精神健康问题，并指导父母关于医治行为的教导。有些特殊的生词我还没有学过，所以我现在转到英语。如果需要的话，希望你们可以用 ChatGPT 来翻译我的话，不好意思。谢谢。So today I'll be speaking to you about youth mental health concepts that are really guiding some of the work in British Columbia, in Canada. There are a lot of different topics that we'll cross and that we'll brush over briefly today. We'll be speaking on Canadian statistics, the concept of window of tolerance, popularized by psychiatrist Dr. Dan Siegel, trauma and hypervigilance, and how trauma can impact the psyche of different people in a different way, despite events, traumatic events, looking very similar. How trauma cannot be compared. We'll be speaking about the protective elements of positive childhood experiences. We'll be speaking about parenting behaviors that are helpful, the concept of co-regulation of the nervous system, secure attachment, self-soothing for emotional regulation, the value of secure attachment in childhood, and emotional regulation. We'll be speaking also on some approaches that parents and teachers can take, and some of the summary lessons which include that all emotions ought to be validated and accepted. I hope that you will see some of your own approaches to your children or to your patients or even to yourselves in the next few slides. This is a thematic lecture, so we won't be going very deeply. Last year there was a survey, 40,000 Canadians, 15 years and older, and it showed that about 1% of the Canadian population has had some episodes of schizophrenia. Bipolar disorder, about 2%. Major depression, almost 8%. Anxiety disorders, 5%. Social phobias, 7%. Autism spectrum, approximately 2%. ADHD, attention deficit hyperactivity disorder, about 5%. PTSD, about 13%. You can see that the burden of disease in Canada is quite significant. The burden impacts patients, impacts the economy, impacts the workforce very significantly. A survey last year of 22,000 youth aged 15 to 24 showed that 1 in 3 girls are suffering from some type of mental health challenge, and 1 in 5 boys. There are genetic factors. Schizophrenia and bipolar disorder, there's believed to be about a 60% heritability, in kind of an increased risk for someone to have schizophrenia or bipolar disorder if their parents have that. Anxiety and depression, there's about a 30% heritability. Autism spectrum, about 50% heritability. And attention deficit and hyperactivity disorder, about a 70% heritability. There are environmental factors. So is the nature of the genetics as well as the environment that the patient grows up in. The epigenetics, the exposure to things like childhood trauma, stress levels, the amount of poverty that the patient experiences, substance abuse, exposure, or balanced living on the healthy side, family dynamics and parenting styles, whether a parent is accepting of their child or rejecting of their child has a significant impact on mental health challenges. This is the concept of window of tolerance. In the center is the ideal window of tolerance where we function our best, where the children function their best. And when stress levels are high, either from the environment or internally, the children can be pushed into the hyperarousal state. In the hyperarousal state, it's often called the fight or flight response, or it's a state where the mammalian response is to fight, to survive, or to run away. On the other side, the dysregulation on the lower side, sometimes called hypoarousal, sometimes due to the stressors, the autonomic nervous system can actually go into more of a shutdown or lower functioning state. Sometimes that looks like presenteeism, where a child may attend school but is not really absorbing anything, versus the hyperarousal, where the child might get into a lot of different fights or conflicts at school or at home. Many of us have encountered patients who have the conflicts from the hypoarousal as well, where the child doesn't seem to be responding to much or doesn't seem to be interested in many things. With therapy and with the appropriate diagnosis and treatment plans and teams, we can actually grow the window of tolerance. We can intentionally increase how much the functional window of a child and build their skills to be able to tolerate more stresses in their environment. A quick note on trauma. Trauma is not defined by how big a particular event is. The person does not define what trauma is for them. It's the brain that decides. And you can't control how trauma is processed. So when someone has trauma, it's not their fault how they are reacting to it. Trauma is different for different people. And we cannot expect people to just snap out of it, even if we want them to. It requires patience and acceptance on their own end to reprocess some of the traumatic events in their lives. When someone is living with trauma, there can be hypervigilance. Hypervigilance in relationships, it looks like a difficult time trusting another person, or always worrying about something, or difficulty relaxing, high sense of suspicion, always thinking that other people are out to trick them or to get something over them. It can be an overanalyzing mind, a fixation on risks in the environment, even though the statistics in reality show that those risks are actually minuscule, but the person is ruminating on them quite a bit. Hypervigilance can actually look like perfectionism, the sense that if I don't do a certain thing and in a certain way, I will be exposed to danger. Also, the fear of being vulnerable, that desire to always look strong on the outside. That can be a manifestation of hypervigilance after trauma. And of course, there's physical symptoms, because all emotions and traumas are stored in the peripheral and central nervous system. There are generally three categories of trauma that our children go through. Acute trauma or single event trauma. Some examples are a major car accident, or violence at school, or a natural disaster. Then there's chronic trauma, repeated exposures. So this is where the home life might be very unstable, domestic violence, maybe war or conflict. And thirdly, there's complex trauma. This is definitely the one that I see most common in my patients in British Columbia, where there are multiple events that may not be related, but compounded, added on top of each other, they eventually produce a significant trauma response in the nervous system of the child subconsciously. Sometimes it's called complex developmental trauma. It typically occurs from early childhood. The good news is that there's emerging literature on positive childhood experiences, kind of their healing experiences that allow the child to actually overcome any of the traumas that they have. And these include strong family relationships, community and social supports, opportunities for play and exploration, sense of belonging and inclusion, educational support and achievement, and emotional regulation and coping skills. When we talk about strong family relationships, so much of it is about secure attachment and open communication. The child having that sense of safety with at least one adult in their household where they feel that they can express when they are scared, when they are feeling vulnerable, when they are feeling like they need help. If a child has one relationship with an adult where they can feel safe, that is very, very helpful. This is a concept that we use when we're coaching parents in British Columbia, that sometimes their trauma is showing up in the words that they speak because of the challenging experiences that the parents have gone through. And their coping mechanism was to maybe toughen up, to be stronger, to just push through. Often the words that the parents use, if it's in a certain negative tone, filled with a sense of scarcity or fear, that can actually sink into the child and become a part of that child's inner dialogue. And we can call that the harsh inner critic. And that inner critic will follow the child wherever they go, potentially, until that they have learned to let that critic go and to bring in their own self-compassion. Self-compassion can also be learned through exposure from healthy narratives from the parents. Another positive childhood experience is having good community and social supports. This is that concept that no parents can't really parent just on their own. We need a whole village. We need the grandparents, we need the cousins, the aunties, we need the friends to help raise our children, and that is a natural and a healthy thing. So we're lucky in the Chinese culture to have often multi-generational households, and we see that also in Canada, that it's very protective to have multiple levels of relationships that are protective. Opportunities for play and exploration, especially play in nature. Free play in nature is very healing and a very positive childhood experience. Structured play and unstructured play are both fine. Games where the child can learn problem-solving skills and learn social emotional skills. A sense of belonging and inclusion in childhood is huge, it's massive. I've seen many of you in our gatherings in the past 2 days really find a lot of belonging, seeing your friends that you haven't seen in a long time. That is so valuable also for the children. That sense of being known for your strengths and the sense of being welcomed contributes so strongly and can be the antidote to a lot of trauma, which can be isolating. In early childhood, this research is from the 70s, there can be different attachment styles, and there are standardized, validated questionnaires that one can use to figure out which attachment style maybe that we have grown up with from our own upbringings. And they can be slightly linked or predictive of our mental health or our relationship challenges. Secure attachment, of course, sounds the most positive, and it's in green, where a person may show up with a sense of confidence, self-worth, and who's able to accept support from others. On the contralateral, on the bottom right, we have disorganized, where there's an intensity, maybe a violence or a hypervigilance. There's a push and pull sense to the relationship all the time, and there's a level of unpredictability. And each of us in our relationships may manifest a different level of this type of attachment in our relationships, and it could be some of those childhood experiences playing out again. There's of course anxious and avoidant as well. And I encourage you to read this literature from Dr. Amir Levine, Attached. It really helped myself when I was working with the youth in British Columbia. So that's Attached by Dr. Amir Levine and Rachel Heller, speaking on the attachment theory styles. Another positive childhood experience is educational support and a sense of achievement. And I think we see that in the schools the children are fostered to do team sports together. They're given tutoring and they experience learning together with adults that model good emotional regulation in themselves and good self-kindness. Emotional regulation and coping skills are one of the last listed positive childhood experiences. Emotional regulation, it really is the ability to tolerate and to accept hard feelings, feelings of sadness, feelings of anger, feelings of grief. And grief doesn't only happen when we lose a loved one. Grief can be a change of environment, a change of household, a change of job, the loss of a pet, for example. And the experience of going through that and realizing that the emotions are not our identity, that the emotions are intense things that the child feels, but that it will pass, and that we are separate from our emotions. And that assists emotional regulation. These are some of the coaching methods or activities for emotional regulation. Putting a name to the emotion is very important, validating it, and also taking care of the self through meditation, through sleep hygiene, taking breaks, we encourage almost all of our parents to do some form of trauma therapy because trauma is ubiquitous. And emotional regulation improves when trauma therapy is partaken in. Attachment and relationships and attunement between parent and child improves. Addressing trauma can actually help parents gain a better understanding of their own behaviors and how they might be able to reduce the transmission of intergenerational trauma. Self-soothing activities, again, this brings awareness in the parents to how stress feels in their body and how they can connect and express that stress and actually let it go. This is a proverb that I thought was fitting. 喜怒哀乐皆为人生. All of these emotions are part of life, and learning to accept and move through the emotions is a huge part of the healing that we're bringing for these children. And just so we don't forget, if we come across our own children that are challenging, with challenging behavior, it's often that they need connection more than anything else. And a lot of times that connection is not judgment, it's just being there and trusting that they can take care of the things that they need to take care of. Dr. Leanne Chung says, always connect and validate a child's emotions before correction. So connection before correction. And validating just means that we need to be there. We don't need to fix anything. And how do we build up the energy to do this? It's through self-care. Thank you so much.
Thank you. Thank you so much for your wonderful nature. Sorry, I have used Chinese.
Thank you.
我来小结一下哈，我们杨教授的话，他非常风趣幽默，他会用了很短的时间给我们进行的对促进青少年健康情绪的这么一个非常精彩的专题讲座。那么他首先是展现了一个目前精神障碍的这些疾病的一个发生，在英国的发生率哈，大概是有比如说像精神病啊，有1%的发生率啊等等。那么也提到的观点，我也是很受益，因为不是这个专业的，也是学习到了一些东西，那特别感谢他。那今天也非常荣幸来参与这次会议，也感谢我们余主委搭建的这么一个平台，让我们走向世界华人医师学会。今天很荣幸和我们这位教授。